Thanks. Apologies that we're following with this talk rather than preceding Jabreen, but it'll serve to allow me to accentuate the points that Dr. El-Khoury has brought up and perhaps reinforce it all the more.
Yeah, I think so.
So I've cut out some slides here in the interest of time, so I'm going to highlight just a few points about the anatomy of the aortic root, and I'll try and tailor our talk to explain what Dr. El-Khoury has been talking about in terms of the functional aortic annulus and the functional aortic root, and why all that's when it comes to repairing the aortic valve. As you can see, the aortic root is the centerpiece of the heart, as it were. It's hidden deep behind the pulmonary valve and right ventricular outflow tract, or the infundibulum. And this can be best seen in a cross-section at the level of the tricuspid and mitral valves, at the AV valves. We can see the aortic leaflets, the three sinuses, and indeed the aortic root, as it were, wedged in the space between the AV valves, the mitral and the tricuspid, and lays, if you want, posterior and slightly to the rightward of the infundibulum of the pulmonary, the right ventricular outflow tract. This particular view is to match what you're used to seeing as the parasternal long axis view on an echo. And what you see here is the aortic root that we're trying to describe the anatomy. This is the centerpiece, as I say, of the heart because it lies behind the right ventricle, posterior. There is the left ventricle, and here's the left atrium. And what we mean when we talk about the aortic root really is this entire functional aortic root and annulus here. And if I blow this up, you can see what it consists of. Right now we're just seeing two sinuses, the sinotubular junction and the attachments of the aortic valve, which run in a scalloped fashion. And what I want to draw your attention to are the area here between the commissures. In this case, this is the membranous septum, and we will discuss these three triangles, if you want, the intercommissural triangles, because they're very important when it comes to dissecting out the aortic root for placement of a Valsalva graft, as you saw Dr. El-Khoury do in several of the operations in the preceding talk. What are the features? Then the red line here indicates the true ventriculo-aortic junction. So if these are the attachments of the aortic valve here, these are the intercommissural or the triangles at the ventriculo-aortic junction, and this line here represents what we'll show you in diagrammatic form shortly as a true anatomic finding, and not the same as what we normally would call the aortic annulus or the virtual basal ring, which I'll show you shortly. So keep in mind then, this is the ventricle, this is the aorta, but there is ventricular tissue that extends into the lower parts of the sinuses for the right and for the left coronary, but not for the non-coronary. I'll explain that shortly. So these intercommissural triangles are very important, that the relations of these and what lies outside them, which I'll come to shortly. And if we see a histological section, we can see true ventricular myocardium. We see what we would call, and here's the attachment of the leaflet, which consists of a fibrous core with the, and this would be the basal attachment. And this here, the junction between ventricular myocardium and the aorta would be the ventricular aortic junction, and here's the true aortic wall. So what are the parts that we're talking about for the functional aortic root? Well, here's the cylinder of the aortic root. We'll start this way, and these are the leaflets. This then represents the top of the commissures is the sinotubular junction. You're all familiar with that concept. The the important point, and if you take nothing else away from this talk, is that this here represents the true anatomic ventriculo-aortic junction. But as you can see, it crosses the cusps, each of the three cusps. And so there is, if you want, within the sinus of the area of the cusp, actual ventricular tissue. And you must keep that in mind for when we're doing a valve-sparing aortic root, or for some root stabilization procedure for aortic valve repair. And then this represents the virtual basal ring. And the reason I've highlighted is that this is not an anatomic feature, but it is very important because this is the line where we place our sutures to stabilize the ventriculo-aortic junction. And you saw Jabrine on the previous one of his slides towards the end, putting the sutures through this virtual basal ring and bringing them out onto right side through the Valsalva graft that he was using. Now, what I will do, I'll move along a little bit to explain that outside these triangles, there is tissue that needs to be understood before it is possible to do the full dissection to allow for placement of a Valsalva graft or other tube graft for stabilization of the ventriculo-aortic junction. And if we were to look at the left coronary sinus and the non-coronary sinus, the interleaflet triangle between the commissures here actually is into the space of the transverse sinus. So that's what's outside there. And so dissection is required down onto the roof of the right atrium and the left atrium to allow for placement of the tube graft. The second of the intercommissural triangles has been cut out here, and what's outside that is subpulmonary infundibulum, pure muscle of the infundibulum or the right ventricular outflow tract. And that must be dissected off to allow for the graft to come down over that area. And finally, the last of these triangles, the intercommissural triangle between the non-coronary and the right, is seen here, and this is related to a number of very important structures, the most important of which, of course, is the crest of the right ventricle or the ventricular septum. And you saw on Jabrine's previous slide where he had dissected right down into this muscle to allow the graft to sit in the right position. Now I'll move along a little. And just to point out that the membranous septum lies in the intercommissural triangle between the right and non-coronary cusps. And keep in mind, especially when you see the wet lab demonstration this afternoon, that the conduction tissue, which is the AV node located at the apex of the triangle of Koch, makes its way through the central fibrous body, but comes through at the membranous septum and surrounded, as it were, by the fibrous tissue here to insulate the tissue from muscle, and then divides up into the left and right bundle branches, the left bundle branch splaying out over the left ventricular aspect of the septum, and then the right remaining more as a cord-like structure that penetrates and goes through into the right ventricle along the muscle of Lancisi, or the medial papillary muscle. And that's to give you an anatomic delineation of what we've just mentioned. Here would be sorry, is the lighting okay? I'm not sure if you can read that, but here are two interleaflet triangles. This is the non-coronary, this is the right, and this would be the left. And the point is that between the right and non is the membranous septum, and we would have the septum here where the conduction tissue penetrates, having penetrated through the central fibrous body. Now, I'm going to cut the talk short at this point so we can proceed and just ask if you have any questions in relation to the anatomic features that we pointed out.
So any questions?